So in the video, they gave some examples of public health, things like making sure people have healthy food to eat or have places to exercise. They also talked about physicians prescribing medication for people who were ill. And these two examples start the conversation about what is the difference between public health and clinical health. In this slide, I have listed several areas where you can clearly see differences between the two. So with clinical health, we primarily think about treating disease. We go to the doctor when we don't feel well, when we're sick, or if you have a chronic condition, you'll visit your clinician to get medication or treatment. That's clinical health. Public health is focused on health. We want to keep people healthy. We are not physicians. We do not diagnose disease, but what we can do is look for behaviors and environmental issues that create health, that help promote health. We look at populations in public health, whereas clinical health looks at individuals. With public health, we're definitely focused on prevention and health promotion, whereas a clinician is focused on, a doctor, when I say clinician, is focusing on diagnosis and treatment. Now, when I say clinician, it could be a medical doctor, it could be a doctor of osteopathy, it could be a physician's assistant, a nurse practitioner. There are many different levels and different types of clinicians that work with disease. Public health also has a lot of different types of jobs that promote public health, and we'll be looking at some of them later on in the semester. So if you look at public health, we're dealing with a community, and what we do is we try to identify the problem. Why is it that people in this community are getting the measles, for example? We identify the issue and define the problem. There's a higher rate of measles than there is usually. We identify the reasons. Well, when we look at the rate of vaccination in certain populations, we find that it's lower, that certain parents have decided not to vaccinate their children, and these are the communities that are experiencing the higher rate of measles, the higher incidence of measles. So what do? We develop interventions. There are things like educational interventions to help promote vaccinations. There are also policies and law. It is now mandatory for students to go to school in California to have a measles vaccination unless that would be harmful to their health. We implement our intervention and then we monitor and assess if it was effective. These are the different steps that we will be talking about as we look at public health. In clinical health, a clinician does similar things, has similar steps, but they relate to an individual. So when they're defining the problem, what they're doing is evaluating symptoms so that they can diagnose disease. They then develop treatment plans, which are like the intervention in public health. The patient implements, and then the doctor monitors, and they may change the treatment depending upon the outcomes.